Hi, my name is Michelle Simmons and I will be recording my physical assessment video for my class, my Rowan assessment class. Can you please give your name for the video?
My name is Patrick Austin.
And do you consent to being recorded for my health assessment class for Rowan University?
I consent to being recorded.
Alright, so first we're going to begin with the eyes, and we're going to begin with the subjective data. Do you have any blurry vision?
No.
And do you wear corrective lenses?
Yes.
Yes, glasses. Any pain in your eyes?
No.
Any watering or discharge?
No.
Any history or family history of glaucoma?
No.
Now, what about your eye exam? So since you do wear corrective eyewear, it's probably important for you to get a regular eye exam at least once a year. How often do you get an eye exam?
Once a year.
Great. All right, well, I'm going to wash my hands and then we're going to begin with the objective data. All right, so first we're going to begin with the Snellen eye chart test. And this is basically the Snellen eye chart test that we will be using for this assessment video. Can you please read the first line for me?
CS.
Great. The second line?
DVOH.
Great. The next line?
OHVCK.
Great. The next line?
HZCKO.
Great. And then the next line?
NCKHD.
Very good. All right. So now we are going to begin with the confrontation test, which is just a peripheral vision test. If you could look straight ahead for me, and can you tell me how many fingers I'm holding?
1.
Great. How many fingers am I holding?
2.
Great. How many fingers am I holding?
3.
Great. On this side, how many fingers am I holding?
1.
Great. How many fingers am I holding?
2.
Great. How many fingers am I holding?
1.
Great. Okay, next we are going to cover your one eye with this card. And I'm going to ask you to look straight ahead. And if you could tell me how many fingers am I holding?
3.
Okay, if you could cover the other eye. How many fingers am I holding?
1.
Great. Okay. Now I'm going to have you take off your glasses for me and put them in your front pocket. And I'm just going to inspect your eyes. First, I'm just going to look at your eyes. The sclera, the conjunctiva. And if you could look straight ahead for me, I'm going to flash a light, but I want you to look straight ahead. All right, great. So now we are going to begin with the next part of our assessment, and that will be your ears. So again, with the subjective data, do you express or have any ear aches?
No.
You can put your glasses back on. I'm sorry. That's we're finished with the eye exam. What about any ear pain?
No.
Any discharge from your ears?
No.
What about any hearing loss?
None.
Now, when you clean your ears, how do you clean your ears?
With the wet cloth.
Very good. So basically just a little bit of teaching. We would just not like you to use a Q-tip because you can basically damage your eardrum. So I'm going to wash my hands again, and then we're going to do the objective part of the ear exam. All right, so first I'm going to begin by inspecting the outside of your ear. And I'm going to just use a light just because it's just easier to see. Just looking inside, you do a very good job of cleaning your ears, Mr. Austin. And then I'm going to do a whisper test. I'm going to whisper in your ear, and if you could just tell me what I said.
Apple.
Great. Same thing on this ear. What did I say?
Not quite sure. Banana.
Very good. Okay. Now we are going to begin with the next part of our exam, which is the nose, sinus, and mouth. A couple of questions for you. Do you experience any discharge from your nose or
No.
your mouth? What about frequent colds?
No.
So how many colds do you think you have per year?
One or two?
Good. Any sore throats, like frequent sore throats?
No.
Wonderful. And any toothaches?
None.
Wonderful. So how often do you brush your teeth?
Twice a day.
Very good. So that's another thing. So just a little bit of teaching. If you could just try and focus brushing your teeth twice a day, and also flossing if you can at least once a day. Going to wash my hands. And we are going to begin with the objective part of our exam. I'm going to inspect your nose with just a pen light. Great. And then basically I'm just going to touch your sinuses. Just going to feel a little bit of pressure. Does that hurt when I press?
No.
Very good. If you could open up your mouth for me, I want to take a look at your tonsils. Say ah.
Ah.
Stick out your tongue. Say ah.
Ah.
I'm just going to put something. Say ah.
Ah.
Stick out your tongue. Say ah.
Ah.
There you go. Wonderful. All right, and then I just want to look in your mouth again, just to look at your teeth. Make sure you don't have any loose teeth there. Very good. So now, Mr. Austin, if you could just stick out your tongue one more time for me. Say ah.
Ah.
There we go. All right, great. Now the next part of my exam is your head and neck. A couple of questions. Do you have any history of headaches, like frequent headaches?
No.
What about any head injury?
No.
What about any neck pain?
No.
So just a couple of just things that we really want to talk about, just teaching. So when you do ride a bicycle or a motorcycle, it would be important for you to wear a helmet. Okay, so now we are going to begin with the objective part of our head and neck assessment. I'm going to wash my hands. All right, and so now we're just going to palpate your head and cranial lymph nodes. So basically checking the head for symmetry. All right, and so the first lymph node is the pre-auricular. The second one is the post-auricular. The third one is the occipital. And then the fourth one would be the submental. And then the fifth one is the submandibular. The sixth one would be the jugular digastric. The seventh one would be the superficial cervical. The eighth one would be the deep cervical chain. The ninth one would be the posterior cervical. And the 10th one would be the supraclavicular, sorry. Wonderful. So I'm just going to feel, if you could just lean your head back a little bit for me. If you could swallow for me. There we go. And then I'm just going to take a listen to your carotid. Okay, next, I'm just gonna have you, I'm gonna support your neck. If you could sit up a little bit for me. If you could bend your head forward and backward, side to side. Turn your head, face this way, and then face towards me, please. There you go. Very good. All right, so now we are going to begin with the thorax. So again, with the subjective data, which just basically asking you a few questions. Do you experience any cough?
No.
Any shortness of breath?
No.
Any chest pain?
No.
So it's important for you to get a flu vaccine at least once a year. Do you usually typically get a flu vaccine?
Yes.
Okay, wonderful. So that's a little bit of teaching. It's very important if you could get a flu vaccine, it could decrease your chances of getting the flu. I'm gonna wash my hands. We will begin with the objective part of the assessment. All right, so if you could take your shirt off for me, we're going to inspect your chest, the front and the back. The t-shirt is fine. Great, okay. So if you could take a deep breath for me. I'm just checking for symmetry again. Okay, and then if you could sit on the edge here, I just want to take a look, or sit on the edge here, I'm sorry. I just need to see the back. If you could breathe for me, in and out. Great, and I'm just really looking for symmetry. Okay, so the next part of the exam is I need to check and palpate your tactile fremitus. So I'm going to have you say 99 as I listen to your chest, okay? So say 99.
99.
Great. Again?
99.
Great. Again?
99.
Great. Again?
99.
Again?
99.
Great. Again?
99.
Okay. If you could sit on the side for me so I can listen to your back. Okay, can you say 99?
99.
Great. Again?
99.
Good. Again?
99.
Good. Again?
99.
Again?
99.
Again?
99.
Again?
99.
Again?
99.
Again?
99.
One more time.
99.
Good. If you could stay like that for me, I'm going to just percuss. Any pain with that?
No.
Okay, Mr. Austin, can you please face the front for me, please? I just want to take a listen to your back. Can you take a deep breath in and out for me, please? Good. Again? Good. Again? Good. Again? Good. Again? Good. Again? Good. Again? Good. Last time. Good. Okay. Take a deep breath for me in and out. Good. Again? Good. Again? Good. Again? Good. All right. So that would conclude the thorax part of our assessment. Now we are going to begin with the heart. So just a couple of questions for you. Do you experience any chest pain?
No.
Any shortness of breath?
No.
At rest or when you're moving?
None.
And I'm not talking about exercising, just normal, just walking,
No.
to the car, back, Any fatigue, like extreme tiredness?
No.
Wonderful. So it is important, just a little bit of teaching, for you to eat a low-fat and low-salt diet and get your labs checked regularly, having them check your cholesterol levels. How often do you go to the primary care physician and have your labs checked?
Once a year.
Wonderful. Okay. So I'm going to take a listen to your heart. All right, so now, just checking here. Jugular vein. Sorry if I'm pressing too hard. Just gonna take a listen, okay? Good, I hear it. If you can lay down for me, I'm going to take a look at your, or try and feel your pericardium. If you can lay down for me, please. You can use this as like a little pillow. Can you exhale and hold it? Exhale and hold it. Don't let it out. Exhale and hold it. Don't let it out. Just hold it. All right, very good, Mr. Austin. You can sit up. Thank you. All right, so now we are going to begin with the abdomen. So just a couple of questions that I have for you. Subjective part of our assessment. Do you have any loss of appetite?
No.
Any abdominal pain?
No.
Do you have any nausea or vomiting?
No.
Are there any fresh food markets in your area?
Yes.
Wonderful. So we encourage you to probably eat or should eat fresh fruits and vegetables. I'm going to have you lay down again for me. We're going to do the abdominal assessment. I'm going to wash my hands. All right. Okay, if you could just breathe for me. I'm just actually just looking at your stomach, and I'm just going to lift this up just a little bit. You can just breathe normal. Just seeing if there's any bulges, any abnormalities. The skin color, everything looks good. Everything looks symmetrical. I'm going to take a listen to your stomach. All right, then I'm going to do a little bit of light palpation. And then just a little bit of deeper palpation. In your right quadrant should be the liver and also your gallbladder. Can you take a deep breath for me, Mr. Austin, and hold it? Good. Any pain there?
No.
Good, okay. All right. All right, so I am going to do some percussion. When I asked you to hold it, I was just checking to see if you had any gallbladder issues. We call that the Murphy sign. I want to just take a feel again for your liver. Like I said, it's in the right upper quadrant. Take a deep breath for me, Mr. Austin. Very good. And exhale. Good. All right, you can sit up for me, please. All right, so now we are going to begin with the musculoskeletal portion of the assessment. So just some questions. Do you experience any weakness?
No.
Do you ever lose your balance while you're walking?
No.
Any tremors?
No.
Any dizziness or vertigo?
No.
Okay. I'm just gonna wash my hands. We'll begin with the objective part of the assessment. So first we're going to inspect your joints, your shoulder, your wrist, your elbows, and your spine. All right, I'm gonna ask you to shrug your shoulders up. Try and meet my resistance. Good, good, good. And then I'm going to ask you to let me see your wrist. Okay. I'm gonna ask you to let me bring me up. All right. Okay. All right, and then now I'm just gonna check your range of motion. So I need to just have you stand up for me. And then I'm gonna ask you to do this with your wrist. Wonderful. We call that the Phelan's test. Sometimes that will, or that should see if you're having carpal tunnel syndrome. You can sit down for me. So I am going to ask you to lift your leg up, and then I'm going to ask you to lift your leg for me. Try and meet my resistance, and then lower it. Good. And do the same with this leg. Lower it. Good. And then lift it. Wonderful. All right, if you could stand up for me. I'm going to ask you if you could turn and face the door, and then just try and touch your hands to your feet. I just want to check your spine. Okay, good. All right, we're just checking to see if you have scoliosis. Have a seat for me. I need to check your epitrochlear node. Okay. And the same thing on this side, your epitrochlear node. All right, so now we're going to do the neuro assessment. The subjective part of the assessment, do you have any history of headaches?
No.
What about seizures?
No.
Tremors?
No.
So just a little bit of teaching. If you have, or if you think that you have exposure to lead, please see your doctor right away, because exposure to lead is not a good thing. All right, so I'm gonna wash my hands for the neuro assessment. Okay, so your cranial nerve 2 is the optic nerve. I'm gonna ask you to look straight ahead. How many fingers am I holding?
1.
Okay, how many fingers am I holding?
1.
Great, and then I'm gonna ask you just to follow my finger. Look to the right. Okay. All right, optic nerve 3, 4, and 6 is the oculomotor, trochlear, and abducens. I'm gonna check your pupil size. If you could take your glasses off for me. And I am going to ask you to, hold on one second. All right, and I had you follow my finger. I'm just gonna inspect your eyes. Great. The cranial nerve number 5 is the trigeminal nerve. I'm gonna ask you if you could just clench your teeth for me. Good. I am going to have you close your eyes. Good. And I'm gonna close your eyes tight. Try and open them. Good. I'm going to have you, I'm gonna touch your face with something light and tell me if you can feel it. So please shut your eyes for me. Can you feel that? The light
Yes.
touch? Can you feel it now?
Yes.
Great. Can you feel it?
Yes.
Great. Can you feel that?
Yes.
Great. That's just a light touch test. Okay. So now we are going to start with the next cranial nerve, and that is cranial nerve number 7, which is a facial nerve. I'm gonna ask you to smile. If you could frown, close your eyes, lift your eyebrows, show your teeth. Cranial nerve number 8 is the acoustic nerve, and we're gonna do the whisper test again. What did I say?
1,
Great. The whisper test on this side.
2,
Great. All right, so now we are going to do the cranial nerve number 9 and 10, which is the glossopharyngeal and the vagus nerve. I'm going to have you stick out your tongue and say ah.
ah,
Good. Cranial nerve number 11 is the spinal accessory nerve. I'm going to ask you to shrug your shoulders. Good. And then I'm going to ask you to turn your head. Good. And again, turn your head. Good. Cranial nerve number 12 is the hypoglossal nerve. I'm going to have you stick out your tongue. Good. And then I'm going to have you say light,
light,
tight,
tight,
dynamite.
dynamite.
Wonderful. Okay. Now I'm going to have you take your finger and do finger to finger test. Finger to finger test. Wonderful. I am going to have you next pat your knees and turn your hands over. Good. Next, I'm going to have you close your eyes. Watch me first, Mr. Austin. Close your eyes and touch your finger to your nose. Good. Very good. Okay, now I'm going to have you stand. You can, while you're sitting there, you're going to have your heel touch your shin. Your heel. Good. And then the other one, heel touch your shin. Wonderful. Now I'm going to have you stand up and walk in a straight line. Good, that's it. Turn around. Great, all right. Have a seat. All right, and then I'm going to have you stand back up for me, but before you do, I'm going to show you the Romberg test, which you're going to put your feet together. And you're going to close your eyes and try and hold that position. So stand up for me, feet together, close your eyes, and try and stay in that position without swaying. Now you're going to do the tandem walking test, where you're going to do heel to toe. So start over here, Mr. Austin. Turn around, and you're going to do heel to toe. The tandem walking test. Okay, turn around, Mr. Austin. All right, that's good. All right, now I'm going to have you hop in one place.
One leg?
Yes, please. That's it. Okay, that's it. And then I'm going to have you sit down for me. And then I'm just going to do the deep tendon test. Again. The reflex test. All right, Mr. Austin. Well, that concludes the end of our assessment. I want to thank you so much for being such a great participant and enduring this session with me. Thank you so much.